Meanwhile, a report released on Tuesday has revealed that health systems in 18 Nigerian states are weak, resulting in poor healthcare service delivery, especially in public facilities. The chairman, Senate Committee on Health, Senator Ibrahim Oloriegbe, revealed the need for continuous oversight to ensure that the Basic Healthcare Provision Fund works for Nigerians. Benedict Uko has more.
In 2014, the National Health Act established the Basic Health Care Provision Fund to address funding gaps hampering effective primary health care delivery across the country. Despite the provisions, access and utilization of health services continues to be marred by systemic challenges across the states. The chairman, Senate Committee on Health, Senator Ibrahim Oloriegbe, while unveiling a report, called on state governments to release appropriate funds and ensure adequate monitoring of the funds to improve public health care facilities.
We are crying that we don't have enough, but the little given to us, you cannot spend it. Despite the fact that the budget implementation was extended up to May 31st, Ministry of Health did not spend all this money. Now, related to that, the Basic Healthcare Provision Fund, I have another question about the quantity. We have 2018, 19, 20, 21, and now 2022. That's 5 years' money. If we ask, it's only 2 years, 2018 and 2019, that has been released. The ranking and what is happening, if you see the slides shown by Ola, many of the states are ranked very poorly. But I think it is not about where you are now, it's about what effort you want to make. I think what should be important with this document for us is for it to be a kind of check on the responsible person in each state to do more. This is a transition time, a political time. How do we use this to bring health up on the agenda? We have all the 18 parties or so having their presidential candidates now. We need to get it across to them. We have several voice maker here. One campaign is about raising the voice of the citizens. Let's demand from every presidential candidate from them, what do you want to do for health in this country, particularly for primary health care. Also, anybody that is seeking to be a leader of the two arms of the parliament must also be committed to health, to retain what we've had, to ensure, as we say, vulnerable group, how do you ensure that the budget for the vulnerable group is this? We demand from those people. These are the critical ways through which we can get good results.
On his part, the One Campaign's Nigeria director, Stanley Achonu, spoke about how weak governance continues to pose a major obstacle to improved healthcare delivery. Also speaking, the chairman of the National Advocates for Health Group, Mohammed Usman, called on the government to provide the required leadership to ensure that primary health care is improved across the country.
This report, which provides comprehensive assessment of the implementation of basic healthcare provision fund by ranking the health system performance across the 36 states and the Federal Capital Territory, use a standard group of health systems indicators and recommended pathways to increase utilization at the subnational level. It is our sincere hope that the conclusions of this report, which will be launched today, will stimulate more action in order to improve healthcare delivery in the 36 states of the Federation and the Federal Capital Territory.
For many years, it took 10 years of advocacy, of serious collaborations, of bringing together all kinds of people. Eventually, by the 10th or the 11th year in 2014, the National Health Act was passed by the National Assembly first, and then, of course, it was signed into law at the last days of the Jonathan administration. Now, when that happened, it looked then, it was put forward like this is what we need. If the legal framework to make sure that the funding system for health in Nigeria, would have a legal basis. And that is what is needed to make things begin to work.
The success recorded with polio eradication, containment of Ebola, and the COVID-19 pandemic has shown that Nigeria can deliver on critical health issues given the required political will and leadership commitment.